Hello, I'm Lexi, and I want to introduce you to the special features of the PreViser Enterprise product. Are you looking to upload a group of your patients to PreViser? If so, you can upload a group of records using a CSV file from your practice management system into the clinical suite. This can save you time and reduce data entry errors. To upload patients' demographic information, select the Import Patients button on the Browse Patients page. Overview the instructions on your screen and select Start New Import. Review the guidelines on the screen. The required fields include first name, last name, date of birth, and gender. Optional fields include patient email and practice management ID. You can click the expanded menus to learn more about each field. Once all desired fields are identified, select Next. By following the guidelines on the screen, you will create a custom CSV file from your practice management system. Then select Next again. If you use Dentrix Ascend or Eaglesoft, you can follow the instructions here. Otherwise, browse your computer for the newly created file and select Next. If your file has a header row, select this box. Once everything looks correct, select Next one last time. Fill out the contact information. This will be used in case there are any technical issues, and click Submit. Now that the file is submitted, you will see a successfully submitted pop-up message. PreViser will process your import. Within 5 business days, you will receive an email confirmation that your file was uploaded. You can click on the email link to take you to review your file upload. Any patients who were verified will be confirmed with an imported status. Duplicate or invalid patients will be noted as well. Keep in mind that these records will not be imported. To update the invalid records, select Download CSV. Filter by unchecking the imported file and update the records. This will include removing any duplicates, updating missed fields like first name, last name, gender, or date of birth. Copy the updated fields and paste into a new Excel document. Save the new CSV file and submit the corrected records as a new import. To do so, select Start New Import. Next, Next again. Select your new CSV file. Indicate if it contains a header row. Next, Next again. Fill out the contact information. And finally, Submit. You will then be notified once your new file is processed. You can also locate previous imports in this section. All successful imports will be in your PreViser Clinical Suite under the Browse Patients list. Now that your CSV file has been processed, add the insurance information to patients who participate in an additional benefits program. You are one step closer to completing PreViser risk assessments. Hi, it's Lexi again. I'm going to show you how a clinician can customize an individual PreViser report through the PreViser Enterprise product. PreViser offers lots of personalization to the clinical suite and reports. The more you customize, the more the report is catered to your dental practice and treatment recommendations for the patient. Clinicians and users can customize the report to each specific patient. Once the assessment is submitted for the patient, you are viewing the report on the screen. Select Edit and then Customize. Any purple dotted area can be updated with simplified score explanations, specific treatment recommendations, oral healthcare product recommendations, and appointment reminders. This is also a great feature to highlight suggested areas of improvement for the patient's oral health home care routine. Any section can always be restored to your practice default text by selecting Reset to Default. Be sure to select Save when making specific notes. Once all your customized notes are entered, select Done in the top right corner. Now each individual patient will have a customized report specific to their oral health needs. again, I'm Lexi. PreViser provides great information to your patients and is a unique marketing tool to set your practice apart. The PreViser Enterprise product allows you to customize your report settings as an administrator to reflect specific practice details on patient reports while educating patients to improve their oral health. If you are logged in as a dental service organization or a DSO administrator, this will update the default text for all future reports done by any of your clinicians at any of your locations. You can also restore your default text at any time to the PreViser verbiage. If you are logged in as a single practice administrator, this will update the default text for all clinicians within your single office location. This tool allows customizing the recommendations for oral care based on risk and disease severity scores. Keep in mind that your clinicians can further customize each patient's report, but the default verbiage is always available as well. To begin customizing your dental practice's report as an administrator, select More, Settings, Assessment Defaults, and the specific assessment you want to update. Within each assessment, you can change the purple dotted areas with your personal clinical recommendations. These areas include scores, how to improve the health of your teeth, the What Can I Do section, and the Additional Resource section. Select Save once you have entered your changes. Keep in mind that you can always restore to the default text by clicking here and Save. You can update your practice details on the report by selecting My Account. Select Edit Practice to update address, practice name, or phone number. To upload a photo, choose Browse and select the desired image. A business logo is a great option to add here, as this will appear in the top left corner for all future reports. The photo recommendations are 480 by 640 pixels, or a 3:4 ratio for optimal viewing. Be sure to select Save once your photo is selected. If you choose not to customize your account, PreViser has a great foundation of information for patients to view. Keep in mind you can change as much or as little as you want within the report. It's up to you. Hello, it's Lexi again. The PreViser Enterprise product offers a very resourceful feature called PreViser Analytics. These analytics provide benchmark information on your patient's oral health and allows you to seamlessly keep track of your organization's progress and where it's going in the future. PreViser is all about prevention and predicting the future. Remember, just because a patient has a high score today does not mean the patient is diagnosed with the disease today. That is up to the treating dentist to diagnose the patient. The high score means the patient has a higher likelihood to get the disease in the future. With early notice, the patient can focus on preventive home care and in-office treatment to prevent the disease from ever occurring. By utilizing PreViser Analytics, you can compare your findings to your claims data and ultimately lead to a healthier practice of patients. With PreViser Analytics, practice and dental service organizations or DSO administrators can track many different behaviors. For example, you can see the number of completed assessments by clinician, the type of assessments being completed, and the frequency of assessments. Reports can be filtered by clinician name, date, frequency, type of assessment, and location. This data can then be presented in a chart of your choice. To access these analytics, select Product in the top right corner and then Analytics. You can sort the usage by location, clinician, user rankings, and details. Under usage, it is possible to sort by perio, caries, and oral cancer. You can then apply filters like dates, chart type, assessment type, and more. For example, you can determine which clinicians are using the tool and how often. User rankings provide a snapshot of information. This data can be helpful for coaching and development. For example, you might pair top users with those struggling to implement the assessment into their workflow. To access detailed clinician information, click the Details tab. Another valuable example is to look at the data by analyzing the risk and disease information. You can filter by date, location, clinician, and age groups. This data is easy to compare with your claims data by using the export feature to help your practice identify gaps in care. For example, if 4 of John's patients are high risk for caries, the provider may standardize the treatment plan of fluoride varnish. This valuable tool can fine-tune your practice by identifying patient needs, highlighting missed opportunities, and uncovering gaps in care.